was in countries like Spain, in Mexico, where will we be? Will there be in Nigeria? There wouldn't have been in Nigeria. So our health system was not really ready at all because right before the pandemic, it was poor. And it's not only poor for antenatal clinic or malaria, even family planning itself. Being a preventive measure is we are not even ready for that preventive measure. Do we have enough contraceptives? We always suffer lockdown. So what happens to that? What's that? What happens to that lady who has, the husband has made an advancement and she rejected because she doesn't want to get pregnant? Two things could happen. She'll be beaten up, or she could be what my friend would call consensual rape. If there's anything like that, consensual rape. Because I asked her, why is it consensual rape? That she's married, she consented to the marriage. So consensual rape. But the thing is, rape is rape. You are not ready for it. Then secondly, what happens to even the children? The children we so dearly love because they make demands. 3, is there enough money to even pay for that expensive transportation for the woman to go to the facility? The man doesn't have. Probably he feeds on a daily rate. He feeds on a daily rate. So what happens to the man? Then the man himself, how does he feel socially? If a man cannot provide for the family, how does he feel? He feels inadequate. And if there's anything a man hates, there are men here, is not be able to hold up and become the head of their family. And the way to become the head of a family is to be able to provide for that family. So there's a lot of social issues around lack of family planning during the pandemic. We may see it as, okay, Shebi is just not there. But what happens in the house? What happens to the individual himself? My image as a man, my image as a woman. My neighbor knows that my husband is beating me for one reason or the other. What is my outlook when I meet this woman later in the day? The children, do they get the love, the understanding that a parent is supposed to provide? Then what happens to their future upbringing? We may think from March to May, the lockdown is short, but it could have an indelible psychological mark on the children that will distort their social fitness within the society where they are. We may not see it, but I've seen it. I'm somehow a grandmother because my sisters have grandchildren. So I understand. Sometimes they call me, they say, Grandma, no, Daddy is not talking to us. Did we offend him? All because he has been locked down. He's not able to go out. And probably that day, maybe my niece refused to budge. So that day, he will not talk. So if we sit down here, we're going to spend the whole day talking about the social effect, but I just give you a pinch of it, that we can go back home and think that this effect is still there. It is still there. Why? Because a lot of breadwinners have not been able to go back to what they were before the pandemic. Some people have lost their jobs. Some people are paid half salaries. I'm sure this is happening. We're paid half salaries. Some people have lost their shops because they're not able to pay rent. Go to the market. I was in ShopRite over the weekend, nicely decorated, but the number of people in ShopRite compared to Christmas 2019, what is happening? Where are these people? And I went on a Sunday. Christians come back from church, they go there and give their families some nice treats. I saw only 3 families. Where are the remaining families? What is the social effect of that? They not coming to that place. What is the social effect of their children not being able to give the experience of, me and my daddy went to ShopRite to eat? How will the mate of this little child see the child? You know, children can be callous, not intentionally. So you are not able to go, and that affects the child. So we need to really think through that. The absence of this family planning it may be just one aspect of healthcare delivery has created so much of social and psychological effect amongst the populace in Nigeria and the world all over. Thank you.
Thank you, Fatima. Thank you so much for that wonderful presentation. Could you give her another round of applause, please? You could see what she had reeled out. I could thematically put them in three areas: fear within the healthcare sector, which led to a lot of people not getting the service that they deserve, and family planning services was one of them. And then, of course, the two types of fears. Fears, health workers are actually fearing each other too. And then patients are also fearing healthcare workers, and healthcare workers are fearing patients. Here in FCT, as at the last count, 300 healthcare professionals have been infected by the COVID-19 virus, just doing their work. And then when we disaggregated it, we found that most of them were actually within the public and private sector, not even in the isolation centers, because the isolation centers, adequate preparations are made to protect them. The other one, of course, is the breakdown of, I call it the command structure of the security forces. During the pandemic, during the lockdown, some of us had to drive around fighting police officers who ordinarily would not allow even healthcare workers to go through, even patients. I've had to occasionally stand in a roadblock for almost 2 hours, trying to make sure that I facilitate movement of healthcare workers and even women who want to go for the antenatal services. So we saw that real life, so to speak. Of course, you do know that there are some good things. A lot of people use bus transportation, that she said, to make sure that they get either their workers or patients to hospital. But most importantly, at the end of the day, I always say a country starts with two individuals, a man and a wife. The community built around that family, the outside concentric ring community. When there's a disruption in the family, when there's a disruption, it disrupts everything. I think she's brought it out so clearly. So I want to thank you, Fatima, for that wonderful presentation. And we're going to have a very robust discussion around it. And then for our international or national virtual participants, please send in your comments, your questions through the chat box, and we'll be able to respond to them at the appropriate time. Now, ladies and gentlemen, can you now join me to welcome Mario Stopes International, Dr. Kingsley Odogu, who is going to make a presentation on innovative approaches to increase FP services during the COVID-19 pandemic lockdown. You're welcome, sir. You have 15 minutes. Microphone. Okay. Okay, bring it. Give me my own back.
Slide, please. Including the Federal Capital Territory. Yeah, take this one. In 36 states of the Federation, including the Federal Capital Territory. And we have various channels of service delivery. First, we have the outreach channel of service delivery, which is present in 24 states. And we also have our collaborations with the private sector, which is existing in where we collaborate with private health facilities to deliver sexual and reproductive health services in 15 states of the Federation. We have our static mobile centers, our hospitals located in 3 states of Abuja, Lagos, and Edo states. Then we have our mobile train providers called the MS Ladies that exist in 12 states of the Federation. And then we have our engagement, collaboration with state governments and the Federal Ministry of Health in 34 states through our public sector strengthening approach. Next slide, please. So our drive is a vision in which every birth is wanted, and our mission is children by choice and not chance. So just giving a little bit of background to my presentation, I would like to say 1 or 2 things about COVID. We've heard Dr. Fatima and Barrister Shekara talked about the huge impacts, the challenges that COVID-19 brought. But we are not out of the woods yet. The last count on the 3rd of December showed that we still had a total confirmed case of over 68,000 cases. And then we also have discharged cases, over 64,000, and then deaths of 1,179. And the cases are still up and running. We are still having new cases. On the 3rd, we recorded about 343 new cases, and we are not yet out of the woods. We still have to maintain all our non-pharmaceutical protocols, and ensure that as much as possible, we are keeping to them and trying to break the disease cycle so that we can be able to continue. So the national COVID-19 guidelines still exist across countries, and also with demands of responding with the demands of directly linked to COVID-19 and the resultant overwhelming effect on the health system, the provision of many services, including the sexual and reproductive health services, became more challenging. So what was the implication of all this? Next slide. So drawing from lessons we learned during the Ebola containment response in Sierra Leone, for instance, it showed that the reproductive health sector faced the highest impact during the lockdown. There were issues around unintended pregnancies, sexual rights violation, and then access reproductive health services were the most hit. Again, there were also logistics challenges around sexual and reproductive health commodities. So there were safety concerns around healthcare providers caused by the infection amongst colleagues. So Marriage Stops Nigeria, as a Nigerian organization, took the decision to act proactively. Some of these misses. So what was our response?
That mic is
So we set up, there were a lot of, we did a lot to ameliorate and see how we did services to our clients. And so some of the things we did,
so some check, man.
we regularly monitored the disease outbreak across all the states. From the team. So we also secured approval from the national and state ministries of health that enabled our teams to move around and work as essential health workers, even in the most difficult locations and across the state. We also had collaborations with NCDC, where we now drew up some protocols to guide our standard of service provision. And then we deployed personal protective equipment for all our team members and service providers, including the use of handheld thermometers, hand sanitizers, and face masks, all to ensure client safety to our clients and staff. We also increased supplies of commodities and consumables, and then we ensured that we mainstream COVID-19 prevention messages in family planning talks across the channels and locations. Our staff provided health talks on COVID-19 before every engagement, including during mobilization as well as service delivery. We also had some, as part of our demand creation strategy, we also saw this as an opportunity where we developed some guidelines, and there was also greater use of community structures as gatekeepers. For instance, the town announcers door-to-door mobilization as well as avoiding crowd and clustering. Next slide. So what did we do specifically? So I'll be going to the channels to tell us what we did. For our centers, I told us that we had 3 static centers where we deliver quality sexual and reproductive health services. So for our centers, we had to move to online engagement. Now, being most of the clients were at home, people looked at the internet mostly during the social media for information. So we used the social media to educate audience on COVID-19 and reinforce the messages of COVID-19 preventive approaches for those, and also use that opportunity to tell our clients that our clinics are still open to provide services. The second thing we did was also to continue to provide services for our clients. We have home delivery service, for instance. Now, the home delivery service system was launched now to deliver contraceptives and drugs, as well as refills to our clients that require them. And this also gave us opportunity to take some samples, to conduct laboratory tests on our clients. There were instances where we also had to pick up clients and drop them, and where clients couldn't get to our clinics due to transportation constraints, and this helped us to reach out to some of our clients. The first thing we did was adopt the telemedicine approach. Telemedicine, this was hinged on home delivery service, where upon running the requested test for interpretation, there is online consultations with our doctors, and with the results of tests already conducted, they are guided on what to do in order to take care of the situation. And this is on a case-to-case basis. Now, our outreach teams that we talked about, we had 24 outreach teams across the 24, across 18 states of the country. And these outreach teams continued to work during the lockdown in collaboration with state ministries of health and with permits from Federal Ministry of Health. So outreach teams were able to go to some hard-to-reach areas, but still minding the fact that there were lockdowns, so they were only restricted to move within the regions where they are located, and there was a daily monitoring of the situation using various various approaches to service delivery. There was also flexibility with schedule and with constant communication with local government reproductive health coordinators and the primary healthcare facility in charges, whom we work closely with. For our private sector collaboration, we made sure that we saw this as an opportunity to support facilities with ensuring that we put in place COVID-19 protocols across the facilities that we support. And this came in as a low-hanging fruit, as most people were expectant. They were anxious about what do we need to do to prevent the transmission of this infection. So we saw it as an opportunity to educate them. We saw it as an opportunity to also support them with some personal protective equipment. And then using telephones, we could make referrals, family planning services to them. And then we also focused on the quality of services that they provide, ensuring that they did not forget the non-pharmaceutical interventions for preventing the spread of the disease. Then our community-based Aristopes ladies also were also going to regions around where they reside to reach out to clients during the lockdown. Activities for the teams were limited within the base locations, and they were also using those personal protective equipment. Especially, there was also the use of WhatsApp to reach out to the clients. And so also our supported public sector supported sites where we engaged with some primary health care facilities in order to support them with the appropriate messaging as well as COVID compliant protocols to ensure that services are not completely hindered because of the impact of the COVID, and at the same time, the messaging and the information that they need to reach out to clients with sexual and reproductive health services were not impeded. So our contact center, we have a contact center, our marriage stop service delivery channel to reinforce, which help to reinforce by the toll-free hotline number 2225. And this number we use as a continuum for all our clients that want to follow up. We will be reached through this contact. And then services are offered in English, Igbo, Hausa, Yoruba, and English. So what result did we get? During this period of lockdown, from 2,343 public health facilities, 168 community-based delivery networks of Aristopes ladies, and 221 franchise network, as well as 3 centers and the outreach teams. Client visit to all the supported facilities was increased by 22% during this period. And the uptake of implants and IUD was most especially affected, and there was an increase during this time. This is a graphical representation of what I just talked about. 3 months before COVID, these were the uptake of services, as you can see. And 3 months after COVID, you can see that services increased, especially for the implants and the IUD. But some of the services were also comparable with what used to be. Reporting rates also have maintained comparable levels during this period. And then when we apply some of these figures to our impact, there's an impact analysis. We can say that over 772 persons across Nigeria were using family planning methods provided through one of MSION service delivery channels. Over 793 unintended pregnancies were prevented, and over 3,968 estimated maternal deaths are vetted, and over 279 estimated unsafe abortions were prevented. So in a nutshell, this was what we did. This was the impact, despite all the constraints that the COVID-19 pandemic brought, and we were still able to reach out our clients with the required services. Thank you very much.
session, very, can I have your microphone? This session is a very important session. The reason is we were involved deeply and we saw how women suffered. And if you looked at your time, at your schedules, you see we were supposed to take Fatima first and then break and then take his own last and then break and then have a conversation on the two. But we now decided, let's have the conversations together so that people can link, because what we have done, Fatima has shown you the problem that was out there, isn't it? Now, Kingsley from MSI is now telling you the solutions they proffered. I was so excited because I was checking in with what all our colleagues were doing in the development world. And then I narrowed down on MSI when I found out that services actually increased in their facilities. And I made sure that the new normal committee was created and make sure they took a lead in that new normal. Because we need to show the world that Nigeria is a great country, isn't it? It's not everything bad that will be associated with us. We are great people. At least in Nigeria, it's shown within the pandemic, within all the difficulties, Nigerians were able to make services available across the country in their sites in Nigeria. So let's give them a good round of applause. And then what you can't find a solution unless you know where you're coming from, isn't it? The work Lafia did was so important also to us to know where the hot buttons were. And that's why, building on this conference, what Fatima and her group had done is documenting these problems. People observed it, but documenting them is very, very important, because anybody that is going to do any program, before you do your program design, you have a baseline assessment. And from that baseline assessment, you say, okay, in so number of years, I'm going to improve services to this level. So the Fatima them have given us so, I don't know how to thank the two of them. As a program person, what they have done, they have actually done everything for us. So it's up to us now to take what they have done and run with it. So ladies and gentlemen, let's give them a good round of applause. But before I hand over to my microphone to my colleague to make some insights too, like I said, Chairman worked with me when we set up the committee for COVID. First thing I said, there's no private sector. When the minister inaugurated the first set of people, he called around to help him fight the pandemic. The first thing I said to him, Honorable Minister, we don't have private sector here, and then we need to get private sector. So I called her. She is the president of the Private Medical Laboratory Scientists of Nigeria. Isn't that great? The lady leading all the scientists in this country, the private sector. So I'll give her to make her own words, but I will plead, because it's not just us. As we are here, people are watching us from all over the world, and people have scheduled their time based on the timetable we had advertised. So we will break and come back by 2 o'clock to be able to have an in-depth conversation with what they had discussed. Is that agreeable to everybody? It's important that we maintain the schedule that we have put out there in the international community. That also shows seriousness. That next time, we still have 4 days to go after today. If we don't get it right today, nobody's going to join us online. They say those people are not sure they won't keep time. So let's try and be good. But I know that some of you have burning questions to put on. So please, let me plead with you. Try and come back 2 o'clock. We're going to break for lunch. The lunch is not ready. So that's network time. If you look at your, this thing is network, isn't it? It says networking and lunch. So we're going to admit people into the lunch. But mind you, if you did not register, we're not going to admit you into lunch. If you're not properly registered, we're not going to admit you into lunch, because there's a select number of people who are to be admitted into lunch. So if you are not registered, this is the time you have an opportunity between now and the next 1 hour where we're going to eat, to properly go to the URL. If you are in doubt, ask the tech people, they'll give you, you go there and properly register yourself. So Chairman, without much ado, can you say a few words too? Give them a good round of applause, please.
Thank you very much. And thank you, Chairman. Thank you for the opportunity to join this gathering. The discussions and topic is really quite dear to me. Um, like our chairman has told us, I was a member of the FCT Medical Expert Advisory Committee on COVID-19 during the lockdown. While most of you were sleeping, we were we were out there making sure that this virus was kept under control. And I can say that we actually recognize that our health systems was already challenged. And like our chairman used to say, we did not have the redundancy. That word touched the honorable minister so much that he kept using it every time that he made a public statement. But we were not deterred by that reality. We, as a committee, we developed a project evaluation tool, which we use to strategize and ensure that appropriate response and control of the pandemic was in place in Abuja. We also took time to document social impacts of the pandemic and its various effects on our population. In fact, okay, in fact, our chairman was all over the place. So he had real time, what I call real time appreciation of uh, we use and community engagement to help the members of the community to understand why the guidelines. Let's not forget that the COVID-19 came with its fear and we were all afraid and we really needed to prioritize things and select the best approach for us. So let me just stop here and not say more. Thank you for the opportunity, Chairman.
Thank you, Chairman. Wonderful support. We used to deal with data. Abi? Data, data, data. Bayo. Yes, sir. Can you click that thing on? Just before we go, can you see this? I just gave these numbers to Dr. Chika. This is just for November. Every day I get daily updates from Gwagwalada Teaching Hospital. This is data from the teaching hospital in Gwagwalada. Can you see the exponential rise? This is just November. By November 5, we had 0 in the facility. You see how it got? You see how it's trending now? By today, I just looked at my destiny. It's 15 cases at the Gwagwalada Teaching Hospital. And that's serious. If you look at what we call the R0, the rate of reproduction, within just how many days? 2 weeks. Within 2 weeks, it has tripled. So this is a sign that we all need to be what? Be careful. So when you see me being fussy around, you can see my ego eye. Somebody came, sat down without a mask. I called them, can't tell her to wear her mask. You get the point. And then not crowding at the distance. So this is very important. I want to thank everybody. So please, I hope you wrote down all your views. What would happen at the time we are going to have the conversation, we will also bring out the key highlights of their presentation so that it can provoke an in-depth conversation. So network amongst yourselves, but remember physical distancing. Yes, and then this is an opportunity to enjoy the very wonderful facility that we are in to have this conversation. But remember, physical distancing. We are going to distribute, what is it called, sanitizers more in the room. So every so often, please sanitize your hands. Thank you so much, and let's meet by 2 o'clock. Please, 2 on the dot, we will start. Give yourselves a good round of applause. And then to our presenters, another round of applause for them. Thank you so much. And I think before we go, let's thank our BOT chair, member who gave us the opening conversation here, and then also the minister's representative here. I know at the end of the day, he's still going to do a very good conversation in terms of thanking them. But for me, I'm just thanking you both for the panel conversation. And I thank both of you for being here. Thanks a lot. Let's work time. Catch up with people. And the procedure people would like to know what you guys do. As a recap, the first presentation was made by Fatima Mohammed. Where she took us through all the challenges that we are seeing during the pandemic lockdown. And some of those were all the, what I call the phobias. Number one phobia was fear of getting infected when you get to the hospital. The healthcare workers were afraid that they will get infected. The patients were also afraid that they will get infected when they get to the hospital. And then all the mobility-related issues, either no transport, or even when there is transport, the challenges people had getting through the security forces. And then, of course, some costs of services went up because there was less people providing services. And then, of course, the attendant endpoint of all of that is family disruptions. And then you know that every country is involved. What every country actually is a conglomeration of families and communities. So she elaborated on all the problems that we had during the pandemic lockdown. And of course, she gave a background of how we have a 25% of unintended pregnancies. Of all pregnancies in Nigeria, 45 of them, 25% of them are unintended. And then, of course, it leads to 24% of all abortions. And then also the aim was to make sure that we have 80% of women going for 4 antenatal care visits before they have their baby, and then to 54% of them to have delivery in the healthcare facility. Anybody who has followed maternal health in the country will realize that one of the key areas that are making our women die is lack of skilled birth attendants. Up until recently, only 35% of our women have healthcare workers attend to them when they want to have a baby. And then if you know simply that only about 7 to 8% of all deliveries are actually complicated, but all the deaths come from there. So because pregnancy and delivery is a natural phenomenon. So one of the things also, we said that there should be online chats and comments. Bayo, I don't know whether you're there or your people. If there are any online chats, please, you can send them to us now so that we can address them. And then having said all that, this was defining the challenges. Then Mario Stopes, before was Lafia Project, headed by Fatima Mohammed from SFH, where she is a director. And now the second presentation was about how in all of these, what are the innovations that we have introduced to make sure that women continue to get services that they deserve? And not only getting, could we improve what is going on? Mario Stope, through their outlets in 36 states and FCT, were able to respond. And then if you look at all their responses, actually the bedrock of all their responses and what they did was to, first of all, take a critical look at all the guidelines that have been developed for COVID-19 should I say, managed facilities or how to engage communities because of COVID-19. And one of the key things as they were speaking that came out very clearly is what we also in Abuja here talked about, public education and community engagement. The minister in FCT here actually set up an ad hoc committee on that. Because if you look at most of the things that happened during the pandemic, it's not that Nigerians are not smart, they don't know. It's nobody has actually explained them properly what this is about. When somebody has been having malaria all his or her life, and then another headache and fever comes, and you tell the person this one can kill you. Say, no, the malaria, why don't they suffer before? Which one you did? So it became important that we use actually behavioral change communication to be able to make a change, not just creating awareness. Everybody's aware, but that awareness is really leading to behavioral changes. It wasn't happening because there was no in-depth conversation. So you could see that they use that in terms of engaging the community. So also, so in that they use community structures, avoided clusters, and then and they use technology because part of the new normal thing is that I'm sure we're going to be hearing conversations during the main conference. The new normal committee made sure that conversations around the use of technology, online engagement, using SMS to reach people, and then also to be able to do some level of home delivery. In Kenya and Rwanda, they actually use drones to deliver um, reproductive health commodities. In some cases, they actually use small planes to drop off blood. Not drones, actually. They're planes, small planes that are remote drones also, so to speak. When I'm talking about drones now, I'm thinking of, which is this one that runs around. What's it called again? The people, is it drone it's called? It's called drone. Okay. That flies you can control. I have two of them in my house, but I stopped using them when NCA said that it's now illegal unless you get a license. So I used to play with my boys. I bought them way when people didn't know about drones. I bought them a lot of money, but it's something very handy to use to play around. Take it in the sky, learn how to fly it. But they use it very actively in Rwanda. This one I saw very clearly when I went to Rwanda 2 years ago. So they have, I don't know when you're going to make drones available here for us to use. But most importantly, too, when I listened to the conversation, I heard, because when I listen to those conversations, like, yes, you have done it, yes, I have done it. I always like to hear the M&E plan. Because anything you plan to do and you have not planned to monitor, you have already failed. But I heard him say there is continuous monitoring and selective evaluation of their strategies. I think that's very awesome. That will make them know when there's a problem. And then, of course, constant communication using the public-private actors, so to speak. And that's why I'm delighted to have the actress here. Nollywood is one area that we need to find a way to engage because their messages are very strong. You know, you'll be struggling to get attention of any lady participant in a room when there's Nollywood film. Abi? Now, wait, now let me finish watching this. So you can infuse a lot of messages through that. So it's very, very important that we do that. So these are some of the things that came out. And then, like I always say, it's important to show of all of this that COVID-19 is still very, very here with us. And that's why Dr. Abbas, I gave him my numbers and he quickly plotted that graph. And all of us saw the graph. And we're going to show it again for people to see. So, Chairman, I'll give you the microphone to do some of, if there's anything I missed, please bring it up so that we can have a healthy conversation. We'll have up till 2 o'clock, I guess, or more, because anytime we finish, we'll go for our lunch. And then after lunch, we'll come back for comments and questions, group work and thematic adaptation, innovation, and resilience. That will take us to about 4 o'clock. So welcome her.
Thank you, Chairman. You didn't miss much or anything. As a matter of fact, you covered quite all the areas that uh, was captured in the presentations of today. And I'm happy that we're highlighting those things today. So we can now proceed with the discussion for the day. If anybody has comments, questions, I, I believe it's in order to invite you to come forward or to rise up where you're sitting and ask your question. You can direct it to any of the presenters for today. Or even if you have some other question that has no bearing on what was presented today, but you think is relevant to today's topic, you can please go ahead.
Thank you very much for this opportunity. My name again is Miriam Allen Gali. Before I go into my comment or question, I'd like to, first of all, thank the Mario Stopes agency or clinic. I am a beneficiary of them, and yes, and it served me well. It's effective, and I haven't had any issues with it since I got it on. Now to my question. I have, coming from the northern part of Nigeria, my mom's sisters, we're a mixed family. We have Christians and Muslims. And a lot of times because of ill health, my mom couldn't come for our umugo and all of that. So we looked forward to having her sisters come do that for us. But her immediate younger sister, who is almost 50 at that time, kept having babies. Every time we want her to, come and help us, she's pregnant. She doesn't like the fact that she's pregnant. Most times, really, she'll hide the pregnancy in a way that nobody would know until she's almost having the babies and you just see them. So she will tell you that no, her religion does not permit her to do family planning. And that's so she's having these children not because she wants them, but because of the cultural and religious perspectives attached to this. I know it's not really part of what we're discussing, but there are quite a number of people in this segment. How do we reach them, and how do we, get them to participate, or you make use of family planning to control the high rising population of Nigeria? Thank you.
Yeah, thank you very much. I want to believe that question will be best addressed by Maristo, right? Okay, two more. Okay, two more questions.
Good afternoon, everyone. My name is Kizu Fume Omo. I work with Breakthrough Action. I'm a reproductive, maternal, and child health specialist. So my question is to Mary Stopes. One of the measures that you had said you conducted during the pandemic was home service delivery. And I just wanted you to throw more light. So how did you know, how were the patients, how were they recruited, and how did they follow up on them, and how long did that take? Thank you.
My name is Esther. My question here is regarding sickle cell anemia children, because I think the rate of sickle cell anemia in Nigeria, the rate of sickle cell anemia in Nigeria is growing in a rapid dimension. But these days we discover that most of the problem comes from the lab, the laboratory results. somebody may go and do tests, maybe like maybe when he or she's been given birth. Then at a certain age, you discover that you may be A positive then, but now you'll be A negative. Like taking myself as a case study, I think I remember before I gave birth, when they run test on me, I was A positive. But last year, when I was sick, the test results showed A negative. So I was now confused. What went wrong? Is it from the lab, or they didn't take it well, or the lab was not conducted well? And of recent, I had a friend that last 2 weeks, she called me regarding her daughter. When she ran tests with her husband, they were A positive. But as at when they went to run tests again, they are now ASAS. So what is the problem? Is it from the lab, or I don't know, or is it with time? Once gene will change? That's what I want to know.
Okay, I think those are the three questions. Okay, so let's start with you. Three questions, then we'll go to the next step.
Okay, thank you very much for that question on religion and family planning. It's basically around social norm change. There's if the social norm accepts that women or families should contracept, there wouldn't be this issue. I am not an Islamic scholar or a Christian scholar, but my interaction with Islamic scholars and with the Quran I read, I guess maybe she's a Muslim, not being biased. There is nowhere in the Quran that it says you should not contracept. In fact, there's a certain verse in the Quran that says you should suckle a baby for how many months? For 24 months. And when it says suckle, I mean, it's breastfeeding, isn't it? Then the Prophet of Islam says, if you count even 36 months, so if you count them into years, it's giving you 2 to 3 years. It's not true. Then we were having a big document development with some traditional leaders and Islamic scholars in Kano, just in October. Then this issue of family planning came up, and the Islamic scholar and the religious leader said, look, it is a sin in Islam for you to bring forth a child that you cannot cater for. So where are people having this basis? It is not true. It is their thinking. It is a traditional thing that needs to change. And like yesterday, I had a couple coming to me and they said, okay, she lost the pregnancy. Is it because she has been on injection that she lost the pregnancy? I said, no, 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 no. She lost the pregnancy for other reasons. Remember, you told me that she missed taking her tablets, her injection for 2 months. And that means the drug inside her, the action has gone down. So it's allowing her bring out an egg. And now, I mean, you have to really go to their level for them to understand. And that's why she's pregnant. So now if she gets pregnant, she will not have any problem again. I said, no, she's not going to get any problem. But where did you go to get the service? He said, oh, it's one of them is near my house. And they are living within the suburbs of Abuja. So you can just arithmetically calculate where she got the service from. So the issue is, can the society see family planning as something that should be part and parcel of human living, that you need to contracept? And can the same society accept and imbibe the teachings of their religion? Because even in the local context, I have come from a Hausa Fulani community. Some years back, if you keep having babies close to each other, in fact, a song is constructed for you. We have a name for it. We call it either Rurusa in the area of Sokoto and Zamfara, or Gwani in the area of Zaria and Kano. So it's something that is not even favored within the culture. So where are people getting it? What I assume from my interaction, I've been in family planning for the past 20 years. I know that they have some phobia. Phobia because this is something foreign. But if you ask them to take a traditional method, they are more comfortable with it. But you and I know that you cannot measure the effectiveness and the dangers of traditional method. And most times, you who go to a traditional healer, you are at his mercy. For example, the padlock they use. Who keeps the padlock? The husband or the medicine man? If it truly works, it means it is at the inkling and likeness of whoever holds the padlock that you have another baby. Because family planning, as somebody has said, is not about stopping birth. It's not about limiting. Limiting comes later, but spacing first. Then you find people who space on their own, they limit because they enjoy that period. You say, okay, now I need to stop because I need to take care of these children in terms of their physical care, their emotional care, and even their economic care you need to give because the children imbibe it from home. So this is it. It's not Islam. It's not Christianity because I know there's certain divide in Christianity that also abhors artificial method. There's nothing like that. The principle is space. The principle is limit when you have enough. And principle is limit when dangers of pregnancies is facing you on the face. Because there is no religion that says you are seeing danger, you go into it. That is suicide. And in Islam, suicide is abhorred. If you commit suicide, there's a way your corpse is treated in Islam. So this is not true. Thank you. I don't know if Kingsley has more to say.
Thank you very much. I think you have dealt with most of uh, the subject matter is. Good afternoon.
Ladies and gentlemen, good afternoon. We have the pleasure of announcing the arrival of the Director General, National Center for Women Development, Barrister Mary Ekpere Eta. To this, ma'am, you're welcome. Thank you. I most sincerely apologize on her behalf. She attended a burial over the weekend and had to fly down to Abuja this morning. And right from the airport, she drove down here. Ma'am, you're welcome, and thank God for joining Mercies. You're welcome.
You're welcome, ma'am.
Sorry, and she went for elections in Cross River State. Thank you. Thank
you. Okay, thank you very much. I think Dr. Fatima did justice to the first question. So let me go to the second question. Ma, we're just taking series of questions from the audience. So on home delivery services, you want to know how clients are recruited and how we were able to provide those services. So it was in two forms. You must agree with me that during the lockdown, there was significant restriction. And so clients were not able to, access contraception as they wanted. And there are clients that, during the lockdown, some of them are on pills, so some of them are on injectables, some even are on long-term implants that have expired, and they needed either a refill or a continuation of the method of family planning that they were using. So such clients, because of the restriction, facilities, they were able to reach us through our online platforms, and we were able to send a team of healthcare providers to go to their homes and give them their refill, going through their records, which we already have, to be able to deliver those contraceptive commodities and attend to them. There are other clients that were new clients that contacted us online and wanted, new optics of family planning methods. Those ones will have to go through a series of consultations, and then we'll link them up with our doctors. And in other instances, we even have to send someone to their homes to take samples for some tests, and eventually we'll arrange and they have their services given. So these were the two forms of approaches that we adopted during the lockdown to reach out to women that have need for contraception during the lockdown. Thank you.
Thank you very much. The third question was from you. I think you were asking about sickle cell disease, and you were mentioning A+, A negative. Good. So what I'll let you know is, well, we thank National Population Commission that for the first time since 1990, sickle cell disease issues came up in the National Demographic Health Survey. This is the first time, that is in the 2018 NDHS. So issues concerning sickle cell disease will also continue to come up, and then enlightenment will continue. Then you have to differentiate between blood grouping and genotype. So what you were mentioning from the beginning was sickle cell disease, but you entered blood group. Okay, two questions. Now, blood group and sickle cell disease, once you are born with it, it doesn't change. So the issue of they have done a blood test for you and you are A positive, and later on they will do the test and you are A negative. The fault is from the lab, not from you. Then the genotyping is either there's one chance in one pregnancy to be SS. There's what they call SS. That's you have the sickle cell disease. There's another one, you have the sickle cell disease, but you may be AS. Then you have another chance of AA, and I think 1 or 2 AS or so. Yes, and then there's SC. Yes, and there are other hemoglobinopathies in the process. So once you are born with it, it cannot change. So you look at that issue from the mistake from the lab. Thank you very much.
Okay, so I just want to add that I was introduced, I'm president of the lab scientists. Okay, so we've actually looked at that, and it's been quite a cause for worry for us. And we conducted in-depth examination as to determine the root cause of most of these mishaps. And we discovered that the same health system challenges that we know we had even before the pandemic it contributes a lot to what you've experienced. What do I mean? We don't respect the fact that professions are professions because people need training. But in Nigeria, if I know DG, and my son just finished his secondary school, and she's the head of the lab group, I will just make a call to her and she will give my son a note and they will give him a job in a lab without the required training. So we found out that most of these discrepancies were coming from that kind of quackery. And we have made several efforts, several appeals to the government agencies responsible for regulation to prevent that from happening. There are even recent trends and in the area of what they call task shifting. Task shifting is where a patent medicine vendor who didn't pass primary school is now being enabled by a quick training to perform lab tests. It's from those kind of scenarios that the man will take the certificate from whoever trained him, that he can now conduct malaria tests, for instance, and from there he will get a job in a health center, a primary health care center, because he has had experience, and that's where he will go and discover. Some of them will discover they don't know what to do in certain situations. They will open the register and copy the last result of 6 months ago, just to free themselves from your wahala. So we need to change our system. We need to address these issues in this country. It's quackery that is the cause of the problem. And if you find out, when you finally got the correct result, it had better effect on your care and treatment. And you attest to the fact that you got it from a more reputable, approved center than whenever else you would have gotten it. So it's been a really cause for concern, for worry for us in this country. So we are looking into it with the authorities. Thank you.
Okay, now we're talking about sickle cell. It's a multi-dimensional problem in the country. One, it also has medical legal issues in terms of paternity. The other one also, nobody can, is the disruption in family life. My other sister had a sickler. The gentleman just turned 52 weeks ago. But for him to be alive today, he's a British citizen. There was a time he got a job with UBA as a top financial analyst for UBA. He came here, spent only 2 weeks. And then called me one day, said, "Uncle, I don't think I will be able to stay back in Nigeria." What was the issue? He just had an episode of his sickling process. And then he had to go to the hospital. The kind of care he got, he was so scared. In fact, 2 weeks later, he was on the plane back to England. We lost that should I say, top-class brain in this thing. He's done 50, but in those about 20, 25 years ago, he's had 2 brain surgeries. He's had so many things, and he's alive today is by the grace of God, and then he's where a healthcare system is. But I can tell you also one story I had as a young medical doctor in the 80s in Kaduna. I had a patient who brought in her son, and the child had all the signs and symptoms of sickle cell disease. I made a clinical diagnosis and said to the woman, "I think this your son looks like he's a sickler, but we'll have to confirm." When I said that this woman abused the day I was born, so how could he have that? She's AA, and her husband is, I think her husband is AS, and she is AA. That there's no one else. I said, "Madam, I didn't say." I said, "That's my working diagnosis." But as doctors, you can take all the abuses in life, but it's your responsibility to stay calm, knowing that whoever is doing that is coming from a position of unhappiness. So it's your responsibility to put a smile on her face. So I said, "Madam, no problem. Let's just take it easy and get the results." So when the result came, because I insisted on taking her blood sample, since she says her husband was AA. No, her husband was actually A and she was AS. And I said, "I must confirm your destiny, and I will confirm that of your son." With so much argument, she accepted. When we checked it, the child was SS, full-blown SS, and she was AS. So the only thing biologically that could have happened was that her husband was also AS. At worst, the child could have been AS, another carrier. So when I broke the news to her, she had a round of abuse. I took my time knowing that some infidelity had happened, or there was a change of child, or the child was changed at birth. Those are the 2 things that could have made that what we're seeing to happen. So, but I was cool, and knowing that she was coming from a very strong position of discomfort. I took my time, calmed her down. At the end of the day, she broke down in tears. What was the problem? She had an indiscreet affair outside her marriage, and that was the one that brought the baby. Now, the problem was now, how are we going to break the news to the man that he has a sickler when he is AA and his wife also he knows that his wife is AS. And it happens to be all these top firemen, they have a baby, they give the woman all the money in the world. They don't really, have time for the family to be. So I said to her, she said, please, I have to husband. That husband, if he asks me directly, I'll tell him the truth. It's my responsibility. But say that the secret will be between you and the hospital. I will make sure that every doctor that sees this patient keeps this private, unless the husband expressly asked. Until I left Kaduna, I was in our hospital for about 4 years. Until I left there, the man never came for one day to find out why the child is always coming to the hospital. No, some men can be very irresponsible, really. So that is it. So it has tremendous amount of it can cause a lot of upheaval in family systems. So thank you very much for bringing that out. But also, I don't know what other questions have been answered, put to you. So I wanted to, because of time, in this meeting, we want to start calling out something that should be made known to everybody that is in Nigeria, especially our policymakers. I'm excited that the president on his own has agreed that population is a problem in this country, and I'll tell you why. But before then, I need to paint the picture very well. We are in a demographic crisis. I don't know if did you hear me? We are what? In a demographic crisis. We must say it and say it the way it is. There's no emotion in it. There is no sentiment in it unless we agree and start today to take what we call deliberate generational efforts. We ain't going anywhere. In the next 20 years, we'll be eating each other. We're already doing that now. And what are the signs you see in a country, you know that you are in trouble population-wise? Number one, if you see a country with a high youthful bulge, 70% of our population is under the age of 30. 70. And of that, 45% is under the age of 15. Only 3.5% of our population is above the age of 65. So the dependency ratio of our country is about 86.5%. So only 12.4% or so are the only ones working for the entire population. That is not sustainable. If you see the pyramid of Nigeria and see the population structure of England, you'll be so amazed. So that's number one. The second one, when you see a high level of immigration, when your young people are leaving the country, even old people occasionally are also leaving the country. Any young doctor that is graduating now, you say, what's your next line of action? I'm migrating to Canada. Canada is a new boss now. And what is it? Most of the people who went to the public schools are trained by federal government money, subsidized. And once we finish, the place is uncomfortable for them. They are leaving. So, and that's not so terrible because the diaspora economy worldwide is $7 trillion. But the amount of money that comes back into this country every year from diaspora is about $29 billion, almost as much as our national reserve. All right? But the one that is so terrible, when non-skilled workers start leaving your country, it's estimated that 14% of all the people who cross the tempestuous sea of the Mediterranean to go to Europe from Libya are Nigerians. If you know what is tempestuous, the rafts are going like this and people are almost falling into the river, but they still do it. Then the last one, even before then, in 2006, I was invited by the Norwegian government to come help craft their reproductive health policy for Africa. Yeah, women's sexual and reproductive health and rights issues. When I sat down with the International Development Minister, the first question he put to me, he said, Dr. Oji, how come every single day 13 commercial workers come into their country from Nigeria? That's as far back as 2006. So you can imagine what is happening. If it wasn't the pandemic, it would still be going. But lastly, sadly, is when nationals start killing nationals. Remember the OPC in the Southwest was formed to protect the Yoruba enclave, isn't it? That shows that something was happening. The Yorubas felt that they had to take laws into their own hands, not in the negative way, but to protect their people. Then the militancy in the Niger Delta, then Bakassi, and then kidnapping. First of all, it was kidnapping in the southeast. Bakassi was formed to counter the kidnapping. Then the Boko Haram in the northeast. Now we have banditry in the northwest and all over the country. So Nigeria is a fixed physical country. We are not countries to get land. Every year, 4 meters of our land is enclosed by the Sahara Desert. And the Chad with about 4 million hectares of arable land, shrinking 5% of its original size in 50 years ago. So these are the things that are putting all these pressures on the country. And I always like to use in terms of money, the Ministry of Health budgets, capital budgets in 2016 was actually 70% of the capital budget in 2007 in terms of dollar value. But in terms of Naira value, it actually had doubled. But you know, if you look at everything we use in health, it's almost like all are imported, dollar denominated. So this is the that this is happening, and that's the 14 executive class. The president had directed them to work on population issues. So with that, it's just for some of you that will eventually get to the major conference starting on Wednesday. You know, we're going to have the major conference starting on Wednesday. The next day, which is Thursday, we're now going to do the opening ceremony because the ministers who will attend cannot on Wednesday because of FEC meetings. So the proper distance, but I will encourage you people to also join virtually. It's going to be an enriching. We'll have so many abstracts that is very enriching. So I want to thank everybody. Chairman, let me take permission from you. Thank you on our behalf. Lunch is served, but before we go, we have what the Igbo people, they call it Nukumang. You know what that means? My big masquerade, when it comes, you must recognize it. And then when it's a woman, we call it Ijelewani. So I would like to invite the DG of the National Center for Development, National Center for Women Development, the only parastatal the Ministry of Women Affairs has to advance women's rights and development. Madam, you're welcome. We will please like you to give your remarks. Please welcome her. And then, before she starts, may we please give a rounding applause to our presenters and then to my co-panel chair. Thank you very much.
Good afternoon, ladies and gentlemen. Good afternoon, ladies. Good afternoon, gentlemen. I think this is better. Good afternoon, ladies here present, and the gentlemen who are here to support the ladies. Supported, because I could see that the women are majority here with very few men to support us. I most warmly welcome our international and local partner for the 6th Virtual Family Planning Conference. The theme of this year's conference is Impact Strategy to Strengthen the Family Planning Post-2020. Adoption, innovation, resilience. This is speaking directly to the heart of the issue of the present or issue of the moment. And I think I will post a little. I listened to some of the questions, answers. They are very, very pertinent, especially what the doctor have just said. We are in for trouble, not for Nigerian fighting with other countries, but the problem is within us and we are the only solution. So at this point, everybody should be ready to resolve. You are talking of health. What about hunger? Hunger is something else in the land. Everybody has become a beggar. People don't want to work. We have thrown away our traditional culture, which we should be earning billions of dollars today to support our economic farming. Everybody wants to live in the urban area. You want to do the best blue chip job, forgetting that farming itself is a very noble and honorable profession. It has to do with sustaining humanity. If we have not eaten, we can't be here. And if there is no tea break, we can't be here, or lunch. If we are hungry, we'll all go home. We won't be here to talk. And the speaker could talk till tomorrow. If you're hungry, you won't listen. And if you're hungry, most people go to steal because they're hungry. The population infidelity, like he has said, some of those women are deprived for some certain economic basic necessity. A woman who is well taken care of and has her own source of income, of course, won't go through infidelity. And that is a very serious health hazard. Also, if a woman is unfaithful, just like you've heard, she brings in a child, not only sickle cell anemia, you could bring in so many things into the family and directly even to your spouse. And it's going to serve like a very low morale for the children upbringing, living in a house where your parents or one of your parents is unfaithful. Apart from the diseases, it's a kind of emotional trauma, which is still a serious medical issue. You see people today walking in the street, like I would like to borrow the word of Glavin Williams, many a man are mad in certain instances and go through life without it being passive. I could proudly say that, let me be fair to our country, 40% of people go through life mad. When I mean mad, it could be driven by health issue, hunger, and other family, when you're emotionally traumatized. Is that not a medical issue, doctor? That's a serious medical issue. And it's a common one. It's not just a family planning issue. The family planning too is very, very important. We have to curtail our population. The population is we're feeling an exploit, an exploiting population. We can't even, some parents, I know of a family where a particular man has about 50 something children. So how are you going to feed them? How can you even parent? How do you know you have children? You can't even take care of their basic necessity, food, health, shelter, and all those things. I think it all boils down to planning your family appropriately. If we plan our family appropriately, I think we do it's going to touch every area of life. So please, I know we Africans we like numerical strength. We like having very big family structure, but it's getting out of hand today. I just came back from home. Even at home, people can't even eat. You see, family, children are malnourished. Children are very unhealthy. People can't go out to struggle. It has to do with family planning. When you plan your family, you know that in the next 5 years, I'm going to have 5 children. This is the source of my income. This is the source of my wife's income. Then you do well. You do very well. Family planning, like all other healthcare delivery, suffered a lot of setback during the COVID-19 pandemic breakouts. Like issue of gender-based violence like rape became an order of the day. It became a pandemic within that period. And what is it called? Psychological emotional trauma, which even though I tried not to see any excuse on that, but that is the basic cause. Some of them, they just thought that you could vent your emotional trauma to the next person. And that again brought a lot of health issues into the family. When a guidance rape, a house help, or any child under his or her care, definitely you don't know what that person is carrying. You bring out the disease, and most times too, break out of population, unwanted pregnancy during that period. The population too, there was a population surge in our community. But however, I'm not a medical expert. That is why I'm looking at it in the social, and economic aspect of it. At the National Center for Women Development, the enabling law primary charge you with the responsibility of stimulated consciousness towards the attainment of achieving activities, high level development and achievement of activities to promote the gender agenda and to promote international development and the gender agenda. So at the National Center for Women Development, we are ever ready to partner and work with you to see how we could reach the woman. There are many things the family health can do with us. we specialize. One of our core area is research. We research into various areas. Like right now, we are prepared to research into the remote and immediate cause of the sexual gender-based violence in the pandemic period, because we want to know for further to help the medical persons, the medical doctors to project so that in the nearest future, if there is a pandemic, we know that whenever there is a pandemic of from the last, this was the remote cause of a sexual violence outbreak or such. So as it comes, the medical expert should be able to furnish them with adequate information and data to help them plan towards curtailing that so that there won't be another pandemic on a pandemic. We won't be struggling. So data for us and research is very important. And we're ready to work hand in hand with you everywhere you need us to conduct research and furnish you with the adequate data. We host the Nigerian Women Data Bank, and we empowered and other things. So, doctor, in any way you find us useful, we'll be here. We could carry advocacy to the grassroots to take the medical, your information. You will be able, you're the policy makers, you're not implementators. So you'll be able to, after the policies, will help you to implement it to the grassroots, and take it around the country. One thing is making policy, another thing is passing it down the grassroots. We have the channel, we have 774 women development centers, so we can get in contact with every other woman, especially in the rural area. We are lovers of rural women. It's not that we're not interested in the urban women, but the rural women are key primary concern, because we know they deserve or they desire all these medical issue. Then yesterday when I went to church, I saw something that interested me very well. After in the church, there was a bazaar, and a group of medical experts came issuing all kind of immunization and all kind of whatever. And I think it's a very good way to pass this message down to the grassroots. So we look forward to such a partnership collaboration so that we could take your message down, do the policy, and we help you implement. Thank you very much.
Thank you very much, Madam DG. Can we give her a good round of applause? Not only that she has spoken, she has also opened up another vista of relationship with her agency. The international development partners here, I hope your ears and eyes are wide open. See Chizoba nodding and nodding, her head almost going off. So, Madam, after the conference, we're going to pay you a follow-up visit, and then we are going to strategize with you, like you said, to make sure that we have services get down to our people. I think with that, we're going to break for this session, and then let me, on behalf of Moji, let me, on behalf of Moji, thank every member of the first session of this meeting. I will start first of all to thank our RH Mama RH, my board member, Dr. Nike Adeyemi, not immediate, isn't 15 or so many years ago, that 12 years ago, she retired as the director of family health. Please, in the Ministry of, please, can you give her a go round? And she's looking very sweet 16-ish, even with her low cuts. I used to warn her, be careful before this young man will start pricing you on the road. So, Mama Arech, thank you for finding time and the distance to be with us. Thank you so much. God will continue to bless you and make you look healthy and stay healthy. I also want to thank Dr. Jumai. Jumai is here. The minister we have seen or not seen for representing the minister here. Thank you, Jumai, for being with us. Your presence here elevated our mood, and then the DG has further elevated it further. Further, isn't it? And I want to also thank Mojima Konjola in absentia. I'm sure at the end of the day, it is Dr. Abazu's responsibility to give that thanks. in a very proper way. And then let me also thank the panelists, Dr. Kingsley Odogu, and then also my good sister and friend Fatima Mohammed for the wonderful presentations that sparked off a lot of insightful discussions. Thank you so, so much. And then let me thank my Madam Chair, the lady that gave us the keynote address. Is a woman of so many parts. You know, when she joined us years ago in IPAS as a lawyer, this is the first time a lawyer is transmitting to be the country director of IPAS. We medical doctors used to think it is our purview, but it's somebody I'm so happy with. I remember the first day I went to make a presentation to FIDA when she was the FIDA chair. And that's where we saw the seed of the wonderful work she's doing. Now she is heading the men. She's the NBA chair. Is here in Abuja here. It's called the Unity Chamber. I promised her we're going to help her be the best. And I want to thank the wonderful audience that has made it happen. And Chizaba, the woman is after me, needling me. And then, of course, the major audience that is not here animated, the online audience, we want to thank them for being with us and also, should I say, tolerating us for not keeping to time. Today is the first day. I'm sure tomorrow will be a lot better than what we saw today. And I want to thank our technical people. We thought this wasn't going to be possible, but I think we've beaten all records so far. Moji Odeku, who is our resource mobilization chair, was calling me from Lagos when she was talking to Chizoba, and she was quite excited that everything is working out well. So ladies and gentlemen, there are a few gentlemen, like she said, we are going to break for lunch. We've done our networking already, so we're going to break for lunch. Please, if you go for lunch, come back here. There are freebies for people who come back. We'll take a head count. Please come back here because we need to complete on the three thematic areas of the conference, and that's adaptation, innovation, and resilience. What is it that we're going to bring? And after that, we'll have to come up with a communique. If we finish today without coming out with a concrete communique, the women are telling Nigerians, this is what we want. I don't think we would have done our job very well. So, for me? Oh, okay. Oh, the food. Okay, no, COVID-19. Okay, I didn't know. Okay, give him that case. I thought you already started the networking. You are giving Madam your... Okay, so please come back. Let us complete the conversation and come up with a action-packed communique. Is that okay? Do we agree to that? Do we agree to come back after lunch? Say aye. Raise your hands and say aye. For those who say hands and say the ayes have it. Abby? Thank you so much. I think we should sing the national anthem. Photograph. The way it's done because of social distance. We can stand here and the photographer can.